For women out there who, just as a general point of interest, what are the screening methods that they need to be paying attention to as they come up through the decades, 20s to 30s to 40s?
Usually I recommend that women start with self-breast exam in some ways whenever they're comfortable or interested, certainly, in their 30s, just to get to know their body. And by the age of 40, we recommend starting with mammography, which is our standard screening method, and it picks up most of the breast cancers that are diagnosed. But I do encourage women to ask, if they do potentially have dense breasts or don't know if they have dense breasts, to ask about that, because there may be additional imaging that's needed.
Take the woman who's just been newly diagnosed through the ER, PR, HER2, and triple negative, what those different kind of breast cancers are.
Yeah, so there are three main kinds of breast cancer. The most common is estrogen receptor or ER positive breast cancer. Next is HER2 positive breast cancer, which has the HER2 protein on it. And then the third is called triple negative, because it's negative for ER and PR, which goes with ER, and HER2. And so that's the three negatives are triple negative breast cancer.
And the common therapies?
We treat them all a little bit differently, but certainly we start with first cutting out the breast cancer and testing lymph nodes if we need it, and radiation if it's necessary. Those women with larger cancers or involved with lymph nodes may need chemotherapy, and we follow the surgery and radiation with chemotherapy pretty shortly. And then women may need therapy directed at their particular type of breast cancer, so hormone-directed therapy for estrogen receptor positive breast cancer, or HER2-directed therapy for HER2 positive breast cancer.
As I understand it, triple negative breast cancer characteristically doesn't go into the lymphatic system, it goes to the bloodstream. So where does that leave you?
It's a great question. For triple negative breast cancer, we treat it up front like every type of breast cancer, that we will do a sentinel lymph node biopsy and examine the lymph nodes. But down the line, if triple negative breast cancer returns, it's more likely to come back distantly elsewhere in the body, in lungs, liver, rather than in the breast or lymph nodes again, or in the bones like other kinds of breast cancer. So, we just have to be vigilant, focus on listening to symptoms, following things up, and making sure that the survivorship portion of our cancer care continues the way that it should.
I guess that's why they want to throw a whole bucket of chemo at you too,
right?
Because it may be somewhere else. I mean, you don't really exactly know where it might be residing.
Exactly, and chemotherapy goes everywhere in our body. So if there is a stray cell that has escaped the breast or has escaped a lymph node or never even gone to a lymph node, the chemotherapy, or hopefully these new therapies we're adding on, will kill those cells wherever they may be and prevent metastases or distant cancer from growing wherever it could be.
And just for people who are being newly diagnosed, what are the most common side effects?
So the most common side effects of the medical therapies that we use, chemotherapy, patients can lose their hair. It can cause some nausea, although the nausea medications now are much better than 20 or 30 years from in the past that we think about. And it can cause low blood counts and potentially risk of infection. For hormone-directed therapies, it can cause some aches and pains depending on which hormone-directed therapy you have, some nausea, but most women tolerate the hormone-directed therapies really quite well.
If you're talking to any woman out there that would like to prevent breast cancer, what would be your advice?
I think we know that healthy diet and exercise are things that can improve that aspect of things, and definitely getting screening, starting it when it's recommended, so mammograms or imaging at age 40, and just making sure that we stay on top of those parts of our health.
Being vigilant.
Being vigilant,
Being
absolutely.
your own best patient advocate, right?
Absolutely, absolutely. Those are my favorite patients, are the ones that come in and advocate for themselves.
And the good news is that most women today are living through their breast cancer and beyond, even metastatic breast cancer.
Absolutely. It amazes me every day. I have remarkable patients who continue working or spend time with their grandkids as they're getting therapies, and even living with breast cancer for months, years. And that's exactly, we want to cure it. If we can't cure it, we want people to be able to live their life as long as possible and as normally as possible.
So don't be afraid of getting the screening, because information is what empowers us, right?
Absolutely, absolutely. It's critical, and asking the question is always the right thing to do.
Thank you, doctor.
Thank you.